हेलो गुड मॉर्निंग मैं डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। A 37-year-old woman present with headache for 6 months. She has been taking analgesic regularly. The headache recently increased in severity for 3 days but was reduced on stopping the analgesic. What is the likely diagnosis? Medication overuse headache, tension headache, chronic migraine and cluster headache. Here the clinical findings are suggest to medication overuse headache. Answer. Well, what is the medication overuse headache? It is also as an analgesic rebound headache. It is also what rebound headache, induced headache, drug induced headache, or medication misuse headache. Next question. A 20-year-old woman present with breathlessness and chest pain. She is known case of mitral stenosis. Her pulse is irregular. No thrombus is seen on echocardiography. What is the best agent to prevent future thrombotic events? Dabigatran, aspirin 150 mg, or warfarin, aspirin plus clopidogrel. Here what the clinical presentation of breathlessness, chest pain, irregular pulse is suggestive of what? Atrial fibrillation. Fibrillation in the patient in having mitral stenosis, what? Oral warfarin is the best agent to reduce the risk of thrombotic agents. What the thrombotic events, and the anticoagulation is indicated for a patient with mitral stenosis, hypertrophic cardiomyopathy, mitral stenosis, hypertrophic cardiomyopathy, previous history of a stroke, in non-vascular atrial fibrillation. The risk of stroke and the need for anticoagulation is assessed with which score? CHA2 DS2 VASC score VASC. Next question. Evaluation of a patient revealed the presence of a mild diastolic murmur. JPP showed prominent A waves. The important point, what is the likely diagnosis? Mitral stenosis, tricuspid stenosis, mitral regurgitation, tricuspid regurgitation. Here the best answer is the tricuspid stenosis. Because the mild diastolic murmur and a prominent A wave JVP suggests to of tricuspid stenosis. Mild diastolic murmur result from obstruction and augmentation flow at the level of what? Mitral or tricuspid valve. Thus both mitral stenosis and tricuspid stenosis present with a mild diastolic murmur. However, the presence of prominent A wave in JVP is pointing more towards the tricuspid stenosis. Causes of the mild diastolic murmur. Causes mild diastolic मरमर क्या क्या है? mitral stenosis, tricuspid stenosis, atrial maxomax, and Austin Flint murmur in severe aortic regurgitation. And Cares-Coombs murmur. Again repeat, Cares-Coombs murmur in acute rheumatic fever. Cares-Coombs murmur in acute rheumatic fever. Next question. A chronic alcoholic male patient presented with the abdominal distension, reduced urine output, and pedal edema. His serum creatinine was 1.6 mg per day. What is the next line management in the patient? Methylprednisolone, heparin, torsemide, octreotide plus albumin. Here the best answer is the octreotide plus albumin, because here the feature of abdominal distension is a chronic alcoholic are suggestive of liver failure, and reduced urine output and pedal edema and elevated serum creatinine are suggestive of renal failure, liver failure and renal failure. This points towards the diagnosis of what? Hepatorenal syndrome, because यहाँ पे लिवर भी अफेक्ट है, किडनी भी अफेक्ट है, तो उसको क्या बोलेंगे? हेपेटोरेनल सिंड्रोम. Among the option here, the best answer is the octreotide plus albumin will be the next first line management. Next question: a 68-year-old man present with cough with yellowish sputum, auscultation revealed bronchial breath sounds. He is hemodynamically stable and not confused. On examination, his respiratory rate is 20 per minute and blood pressure 110 by 70 mmHg. Lab reports show urea level of 44 mg per day. What is the next best step in management? Admit to ICU without mechanical ventilation. Admit to ICU with invasive mechanical ventilation. Consider admission in a non-ICU setting. Give antibiotics and send the patient home. This one is the so here the best answer is the consider admission in a non-ICU setting. Best answer is but the patient should be considered of admission is a non-ICU setting. Productive cough along like with auscultation finding of bronchial breath sounds in the patient is suggestive of community acquired pneumonia. The next best step management hospitalization in community acquired pneumonia based on the CRP 65 score. Community acquired. So that's all, and thank you and keep it.